Hello and welcome back to the Focus PT YouTube channel. I'm Burke. I'm a physical therapist in clinical practice, and I do orthopedic and sports physical therapy with a specialty in climbers and endurance athletes. Joint hypermobility is pretty common. In a recent UK study, they found 10% prevalence among the population, 70% female, 30% male. Other more serious hypermobility syndromes have a lower prevalence but are much more prevalent than commonly thought. In the past, scientists believe 1 out of 5,000 people suffered from a certain kind of rarer hypermobility syndrome. But from this recent British Medical Journal study, they found that's more accurately 1 in, say, 500, which is quite significantly more prevalent than previously thought. The most common musculoskeletal, or MSK, manifestations of hypermobility are joint and muscle pain and instability. We are now understanding this condition to be a spectrum of disorders that involves the whole body and many of the body's systems. These systems can include the cardiovascular and gastrointestinal or GI systems, the skin, the inflammatory cycle and mast cell activation, chronic fatigue and chronic pain problems, and basically many other difficult to identify and treat types of problems. It took a mean of 14 years from first symptoms to reach a diagnosis. More than half of all subjects were initially misdiagnosed, and 70% of subjects had been given inappropriate care. The delays to diagnosis and the inappropriate care many subjects felt were responsible for worse complications from these problems later on in life. If you've struggled with these problems yourself, or if you're a parent and you have a child that has had similar struggles, know that you are not alone. While this can seem pretty serious and scary, medicine and science is making progress at recognizing these syndromes much more quickly, and clinicians like myself can recognize it sooner and help our athletes and patients implement the right strategies and do the right things to, number one, keep from getting injured, and number two, maximize their physical musculoskeletal potential to live an active and happy life. You could say that it takes a village to work with this population, and that is very, very true. No one provider or strategy is going to work for everyone. But I've been around for a little while, and in that time I have learned a few useful strategies, and that's what I'm going to share with you right now. My 5 top tips for staying injury-free and managing hypermobility if you are a climber. Okay, on to the tips. Be proactive with small injuries. This is my first tip because really I think this is the cornerstone, is don't let a small injury become a large injury. One of the early ways that I, as a physical therapist, can recognize the presence of hypermobility is when a patient comes in with an injury that should have healed and it's not in an otherwise healthy person, or there's a history of multiple injuries from seemingly benign causes, or there's an injury that flip-flops back and forth, both shoulders, both knees, both ankles, fingers, whatever it is. There's something that just doesn't seem a little bit right. And that can come when we let small injuries grow into larger problems. So stay proactive, take care of the little stuff. Address pattern tightness early and frequently. Pattern tightness means essentially the tightness that forms from doing your sport, doing your activity, having a certain posture, like if you're typing, if you're a student, or if you work at a computer. In climbers, the pecs and the lats are power movers. They help support us, they move us up the rock, and they both attach to the front of the shoulder. As a consequence, when they develop hypertrophy, when those muscles get bigger, they can develop tightness that causes the shoulder to shear forward in the socket. Now, by itself, this doesn't usually cause problems, but when we go to move, especially in the later ranges, the more extreme ranges, that shearing sets us up for injuries to other structures like the shoulder capsule, like the tendons of the rotator cuff, causing impingement, causing tears, causing biceps problems, a whole host of issues related to what I'm calling pattern tightness. The best way to address this is to work with a professional like myself, like a movement coach. A great personal trainer can do this as well. A massage therapist can identify areas of habitual tightness and make sure that your system is balanced as best as you can. Condition with control. Hypermobility involves some degree of physiological change in your tissues. There's typically more elastin and less collagen, and collagen is the tough stuff. That's the matrix of fibers that resists stretching and pulling. And if you don't have as much of that, your tissues are going to be more elastic, and therefore they will go further, leading them closer to the point where they will sustain an injury. They'll go too far. So condition with control to prevent the forces that you're using when you train from causing tissue damage. Two simple strategies to do that. One, do exercises in what is called closed chain. For climbers, if we're doing strength for the upper body, closed chain is essentially compressive type moves where your hand is flat like you're doing a push-up or a plank, or you're really stabilizing your shoulder against the surface while you're doing your motions. And the second strategy is to use band resistance in addition to dumbbell type weights. And the reason for that is as you stretch a band, the further you go, the more force there is. And if you do this properly, that force will actually load your joint and stabilize your joints. If you do it improperly, it can lead to more shearing across your joints. So some care is required if you're going to use bands to make sure that your alignment is really, really good. Build both endurance and power. Endurance means you will be somewhat fatigue-proof, allowing you to climb longer, to do more activities before you get to the point where you fatigue out and your tissues are vulnerable. And power is necessary when you need to hit the gas, to do a move, to get yourself through a transition safely without being all over the place. So we need to train both sides of the spectrum, and they are trained differently. Endurance means we are doing more holds, we're doing longer repetitions, more sustained kinds of movements, but typically with lower load. And power moves are going to be faster. That's how we identify power moves. But for you, if we're adding speed, we need to be careful. And to be careful, we're gonna move joints through a mid-range of motion. So we're not doing power moves way at the extremes of your body's movement. We're gonna be doing them close into your body. You can imagine that you're a headlight of a car that has a beam of projection that might come out like this. Keep your power moves within the range of that beam, not out to the sides beyond it. Now, when you are on the rock, when you are in the gym, your training will help when those are required. You do not have to train at the extremes of your body all the time in order to be capable and strong there. Get the bulk of your workouts, call it 85%, within that headlight analogy to keep your joints and tissues safe. Watch your volume and recovery. This may apply more to gym climbers because the potential for high volume is very, very high in the gym setting. Remember, muscles get tired, but connective tissue doesn't have contractile fibers and it doesn't feel fatigue in the same way that a muscle does. When you are straining to do a workout, you are straining everything. You are putting a load through everything. And your muscles may register that fatigue later, earlier than other connective tissues. If you know you are vulnerable, you have to walk as slow as your slowest team member, and that is going to be your connective tissue. So keep a lid on the volume, develop a sense of how much volume is a healthy amount for you, based in part on how good you feel within the next 24 to 72 hours. If you feel good and ready to go 2 or 3 days later, then your volume was probably fine and you could stay at that volume or bump up slightly, 10% max. And do that step by step until you get to the point where, okay, maybe you're starting to feel some things twinge randomly when you go to open your car door or roll over in bed, or there's going to be little tweaky sensations that your body may send you, little messages saying, hey, pay attention. Something's not quite right here. When you feel those signs at the gym, notch it down, back off a bit until you are at a lower volume and intensity. Boost your recovery. Your recovery is a combination of things. It's time, it's sleep quality, it's diet, it's stress management. For you, it could be supplementing things like collagen to help your tissues get the raw nutrients and things they need in order to heal in a strong way from your workouts. Make sure you treat recovery as the important stage that it is. Recovery is where your body actually converts stress to strength. And if you are missing that recovery step, or if it is compromised, from stress to strength is going to be impaired. And the next time you go to build on that strength that you expected to have, you may find problems. So take care of recovery. If you want more information on this topic, I recommend starting at hypermobility.org. I will leave a link to their website in the description below. As a physical therapist, take-home message, it is vitally important to stay active, to keep moving, to train, to improve your quality of life, to do something that engages your heart and your spirit and your soul. If you've struggled with this problem, I hope these tips have been helpful for you, and I hope to see you healthy and happy out on the rocks.